I am Dr. Fasamade, and I'll be presenting the influence of diabetes education on self-care behaviors, anthropometric, and blood pressure in type 2 DM patients attending LUTH. And these are the authors of this paper. I'll be following this outline. We all know that, by definition, diabetes education is a collaborative process through which people with DM or those at risk of DM gain knowledge, skills needed to modify their behavior and successfully self-manage their disease. But to achieve optimal glycemic control in type 2 DM, they need several demanding self-care behaviors like managing their diet, activities, medication, monitoring blood sugar, foot care. But these are very difficult lifestyles to make and sustain without support. And we know that there's a link between obesity and type 2 DM. You have adiposity-induced alterations in beta cell function and insulin resistance. And this can be ameliorated with adequate weight loss in type 2 DM patients. And several studies have revealed the beneficial effects of diabetes education. So this diagram just shows us there are 4 outcome measures in diabetes education. You have the immediate phase, you have the intermediate phase, and post-intermediate phase and long-term phase. The intermediate phase is learning. Sorry, the immediate phase is learning. Intermediate behavior change like being active, eating, and medications taken, which is the focus of our presentation today. So these are our objectives: to evaluate the impact of diabetes education on self-care behaviors, blood pressure, anthropometry, and it was a prospective randomized intervention trial using a structured diabetes education program. We recruited 153 subjects and they were randomized into 2 groups. And these patients were seen over a period of 16 weeks. So these are our results. 142 subjects completed the study, giving us a completion rate of 92.8, which was quite good. And diabetes education resulted in significant greater improvement in waist circumference, systolic blood pressure, diastolic blood pressure, compared to the control group. And the mean change in the self-care behaviors was significantly higher in them, in the intervention group. So this table is just showing us the mean changes. We compared the mean changes between those in the intervention group and those in the control group. If you notice, control group has a minus. They actually gained weight. Their BMI was higher at the end of the study. Their waist circumference was higher, waist hip ratio higher, BP higher, and though their self-care behavior, which was measured by this questionnaire, was just slightly higher than the baseline. So when we now compare the mean difference between the intervention and control group, it was significantly different for waist circumference, the blood pressures, and the self-care behaviors. This diagram is showing the frequency. We compared those that improved in the 2 groups. So we noticed that in the BP group, for blood pressure, the frequency was higher in all of them. The blood pressure, BMI, the diastolic blood pressure, waist circumference, waist hip ratio, and everything was significantly higher in the intervention group. That's those that had improvement. And this diagram is just showing the mean change in the self-care behaviors between the 2 groups. It was significantly higher in the intervention group. And the self-care behavior was negatively correlated with the blood pressures and HbA1c. And the Association of Diabetes Educators defined a continuum that recognizes 4 phases of diabetes education outcome. which I discussed earlier. And we noticed that the behavior change has been defined as the primary outcome. If our patients don't change their behavior and maintain that change, it's difficult to have the clinical improvement and this long-term improved health outcome status. So in our study, we find out that diabetes education had a great impact on self-care behavior, which was associated with improvement in the blood pressures and glycemic control in the intervention group. And this intervention group had improvements in all anthropometric indices from their baseline to the week 16, especially for waist circumference, while the control group has worsening of anthropometric indices. And we know that obesity, especially abdominal obesity, is a risk factor for insulin resistance in type 2 DM. It's also a risk factor for hypertension and other medical and social conditions. And this study has shown that the significant positive impact of diabetes education on waist circumference, which we know that is a marker of insulin resistance and cardiovascular risk. So we can just interpolate that there was some insulin resistance, insulin sensitivity improved after diabetes education in this intervention group. Weight reduction is a key target in diabetes care, and it will help to improve glycemic control, blood pressure, quality of life, and overall reduce the cardiovascular risk of our patients. So in conclusion, diabetes education is key in the management of type 2 DM patients. It has significant effect on self-care behaviors, waist circumference, and blood pressure. And weight reduction should be a key target in all our obese type 2 DM patients, and it will help to improve their outcomes. Thank you. These are my references.